I'm Rob Gelder, and welcome to this episode of Commissioner's Corners. Today we're going to be talking about healthcare and our local community, so stick around and you'll learn a lot. Welcome back. Joining me now is Dr. Bonavie Rogers, who's the Medical Director for the Peninsula Community Health Services, and Dr. Scott Lindquist, who's the Health Officer for Kitsap Public Health. So, Dr. Lindquist, if I could start with you, could you tell us a little bit about the Kitsap Community Health Priorities process that unfolded over the past couple of years?
Yeah, about 2 years ago, the county got representations from around the county, from the hospital, from clinics, from social service providers, from the health district, and we all sat and tried to come up with some priorities for health that we all felt were common threads. A lot of the health concerns for the county these days are so big that not one entity can tackle them. And from that, one of the biggest concerns became access to healthcare, and we'll talk a little bit more about that. But access to healthcare is not universal in Kitsap County. We have been following these trends essentially for the last 7 or 8 years, and any adult aged 18 to 64, about 84% of our adults in the county actually have current health insurance that allow them into C. Now, that's roughly about 20% of the population that doesn't have a regular health insurance. And that was one of the concerns for our KCHIP process, was what happens to that 20%? Is it disproportionately into the emergency room and into Peninsula Community Health? And we'll talk a little bit more about that later, but specialty care is one of the biggest concerns also.
So can we talk, and I'm going to turn to you, Dr. Bonavie Rogers. Can you tell me a little bit about what kind of gaps you're seeing? What's the need and the gaps in the healthcare here in Kitsap County?
In terms, as Dr. Lindquist mentioned, even in our clinics that we've been seeing, 2012, about 57% of our patients were uninsured. And that's what we do, is we offer primary care, basic primary care from pediatric to geriatric. But in the last several years, even like just a few weeks ago, I saw a patient in her 60s. She's diabetic, but she doesn't, reach the age of Medicare, so she's in between and she has no coverage. But I'm able to see her for her primary care needs for her diabetes, but she needs to see her eye doctor, which is specialty care, and she couldn't afford it. So unfortunately, she has some blurry vision, so we'll have to kind of find out and call around to see which ophthalmologist will see her for a slide. And we've had wonderful partners who's offered that for certain patients. So that is, as he mentioned, specialty care is definitely a major need and gap.
So what are we talking about in terms of numbers in Kitsap County of uninsured or underinsured, or even with Peninsula Community Health?
Well, we're about 250,000 folks in the county, and roughly 20% of that population. Now, I said 18 to 64 is the 84% that have insurance, so you could do the math of essentially 20% of that 250,000. We do have good health care coverage for our kids in this county, though. The state does do a very good job, almost universal health insurance for our kids.
That's great.
Yeah, but it's a sizable population.
We estimate about maybe 30,000 in the county that's uninsured, and about, we would say about maybe, we got our statistic about 80,000 that are underinsured. And when we mean by underinsured, it's like, coverage from our state. So like Medicaid and a little bit of Medicare, because they still have to pay 20% of some copay, specialty. So roughly that much patients are underinsured.
So there, I guess for a lack of better terms, there's a lot of people falling through the cracks.
Yeah.
And even with healthcare reform coming and the Affordable Care Act, there's still issues of people needing to connect to services that I don't think will be going away anytime soon. Correct me if I'm wrong. But Dr. Lindquist, kind of sort of getting back to you, why is access to healthcare so important from a public health standpoint?
Right, so I think there's a couple things to think about here. When someone doesn't have health insurance, they don't take care of the prevention. So suppose you're a pre-diabetic patient. Instead of getting into healthcare where you're getting screenings and preventing diabetes, you have no access to care, so you end up having complications of your diabetes and ending up in the emergency room, which is a very expensive way to pay for care. And you may not think that someone else having insurance doesn't impact you, but when that emergency room is so busy with patients that don't have access to health care, it makes it tough for folks with a heart attack or emergency situations to get in. And that cost is not just absorbed by the system. It does reflect a cost that I will pay as a person with health insurance so that people are taken care of. So it's a cost issue. It's the most expensive way to pay for health care, is to pay for it on the back end through the emergency room for people that don't have insurance. But for a public health standpoint, the more prevention we can do, the more money we can save, and more lives and years of healthy life we can project out into the future.
So, do you have anything to add on that?
And the key to prevention is having a primary care provider that they can take care of all your wellness and health maintenance. And prevention for like diabetes or the ophthalmologist is very important for a diabetic to see once a year so there's no further damage in their eyes. So, and it's, you know, that's been the challenge, is just kind of, not the primary care, we as Peninsula Community Health Services, we have 4 clinics. We're more than willing to see any patient that comes through our door. But for specialty care, it's been a challenge. The other challenge has been behavioral health, substance abuse resource has been another challenge in the county for us.
So if there are those individuals who are seeking care in the community, they end up in the emergency room, what systems, is there a good handoff from the emergency room to the primary care setting to say, okay, we really need to have a home for this individual?
In Harrison Medical Center, they do have this county call rotation. So if a patient does not have identified primary care, they'll, you know, go in that rotation and say you need to follow up with this particular patient. But sometimes that could be kind of problematic because based on the income and their slide, they may not be able to afford that particular clinic. But because we're a community health center and federally qualified, our slide is a bit more affordable. But I think Harrison Health Partners also has a very good slide for an insurance. From a primary care perspective, I think we do a pretty good job.
Yeah.
But I think from a specialty, behavioral health, substance abuse, I think, and adult dental is another big gap, has been problematic.
And I think that was one of the things that bubbled up as part of the Kitsap Community Health Priorities process. As Dr. Lindquist mentioned, there was a lot of different ways to define access to health care and mental health, dental health, and they continue to be issues of need and concern in the community. But I think that our hope was around Project Access was to begin to implement something that could be replicated and expanded in the future, so that if we test it with some specialties, we can then move on to try to expand into mental health and dental. So I think it's really important. And I just want to say there's always this opportunity. Is there something I didn't ask that we need to make sure that our viewers know about when it comes to the need of individuals with health care and that disconnect that currently exists? What do you see coming down the road?
Yeah, I would just reiterate your point that I think the best way for us to do good health care in this county is to have a medical home and do preventative health care, and that the changes in the healthcare reform are probably not going to solve these things overnight, that we're going to have a unique Kitsap solution that can still address these.
And I concur with Dr. Lindquist, is that, you know, it's really important to have a medical home, and that's why Peninsula is really trying to get to that point, being accredited for being a medical home, so we can serve all the people in the community for primary care. So I always have to say primary care. So Project Access is very vital in terms of helping with the specialty gaps that are around.
So wonderful. I just wanted to thank you so much for taking the time to be part of the program today. It's definitely a meaty and large issue that our community is coming together to try to tackle. And thank you very much for both of you for the part that you're playing in making this a success. So stay tuned for more. Welcome back. Joining me now is Dave Foote, who is the Executive Director for United Way of Kitsap County. Dave, thank you so much for joining me today.
You're welcome. Glad to be here.
Can you tell me, why is United Way of Kitsap County interested in access to healthcare?
Well, first of all, United Way Worldwide and all of United Ways across the country, we have health as one of our main issues and one of our goals. Goes along with education and income, or basic needs.
Okay. So Dr. Lindquist was talking about this a little bit previously, but the Kitsap Community Health priorities. So how did United Way fit into that?
Well, it was very interesting because for many years I've thought that there were too many assessments done across the county. And so I started talking with folks about let's get together and let's do one with many partners. And Dr. Lindquist was the first one I talked to, and he said, Dave, that sounds like a great idea. So then we brought in Harrison on it, and we helped to fund it, all three of the partners, and then we brought in some of the other agencies to be charter members of the KCHIP. Worked out very well.
So one of the issues that bubbled up out of the KCHIP process was access to health care. And what we're talking about today is really specifically the access to specialty care. So one of the things that, I guess my question is, how does funding an expansion of Project Access Northwest into Kitsap County, how does that fit with the direction that United Way is going?
Well, United Way is going the route of what is called community impact or collective impact, and that is that we are starting to listen to the community and what the community believes are the important issues to address. And so we said right from the beginning when we started the KCHIP process that at least one thing that came out of KCHIP was something that the community said was important, and that would be something that we would be willing to get involved in and to fund. So that's how it came about that is our first community impact project.
So we know that the expansion of Project Access into Kitsap County isn't funded just right now at this point in time by United Way. Can you talk a little bit about some of the other funders who stepped up as well?
Well, Harrison Hospital, of course, stepped up, and that's very important for them because we know that it's going to have a positive effect on their emergency care and getting some of those issues out of their emergency room and making more room for people who need to use the emergency room. So we're very happy that we're partnering with Harrison Medical. They're also one of our bigger supporters as well at United Way, so we're very happy to be partnering with them on this project.
So how is the environment for fundraising and or basically making investments, strategic investments in programs changed?
Well, across the country, as I said, United Way's worldwide across the country, we're doing what is called community impact. Many of the larger United Ways have gone to total community impact, and where they've listened to the community, they put out an RFP into the community, a request for a proposal, saying this is the issue, this is the background, these are the outcomes we're looking for, these are the goals that we want to meet, and then finding those partners in the community who believe in those things and want to help solve those problems, or at least put more than just Band-Aids on things. And I think this is one of those issues.
So have United Ways in other areas experienced any changes in sort of adopting this community impact model?
Well, one of the things that communities are so used to a certain amount of error, certain agencies that United Ways have funded, so there is a little bit of angst about it when we move to that. We waited a long time to get into community impact because we wanted to see how others did it and what kind of problems they faced. We wanted to try to avoid those issues and those problems. So we've taken it real slow. This being our first step in letting people know that this money that we put into Project Access is going out there. We haven't received the questions about it. It's been more like, oh, that's a good idea. So we've kind of learned from others as to how they've done it. So we're taking our time to get into community impact. And we're now talking with the agencies more and more about what we're doing, why it's important, how it's going to help the community, how it's going to help move people forward.
Well, I think it's always important that we have the leadership in our community that makes some of the tough decisions sometimes and just kind of leads and defines the path for that investment. And I think with the conversations that we're having locally about our overall health of our community, United Way is well positioned, and I just want to thank you for your leadership in making those investments in our community, and specifically around today's program anyway, around health access.
Well, you're very welcome, and we're glad to do it. Like I say, this is the future. This is the way things are going to be. It's going to be listening to the community, not just listening to individual agencies.
Well, thank you so much for being part of today's program. I appreciate it, and for everything that you do.
You're welcome.
Stay tuned for more. Welcome back. Joining me now is Ruth Ann Ralsum, who happens to be the Kitsap Coordinator and Case Manager for Project Access. Thank you so much for joining us today.
Thank you for having me.
So let's, for the audience's sake, tell us a little bit, what is Project Access?
Well, Project Access is essentially a specialty-centric nonprofit organization. Project Access was actually began years ago, probably about 18 years ago, in North Carolina by a group of very dedicated physicians who were approached with the need of specialty care. And of course, they wanted to help their community and do what they could, and they said, you know, we absolutely want to do this for our community, but guess what? Everybody needs to share this burden. So they went around and got buy-in from all specialty care physicians, also from the hospitals that they're affiliated with, from all the connected service providers where anything cost-related is connected with them. So with all of that, they were able to really share the burden of health care that for people that are uninsured and underinsured. And what that means locally for us, for patients, is that they now have access to specialty care.
So I can ask you a question though?
Sure.
So that it started in North Carolina 18 some years ago, but Project Access in Kitsap and in Project Access Northwest is not part of that. It's its own free standalone?
Right.
Okay.
So Project Access Northwest started in King County in 2006 and also branched out into Snohomish County in 2010. And I'll talk a little bit about more of the successes that we've had in King County as we go along.
Okay. So how does Project Access work? What does that mean? If someone needs to see a specialist, how does it actually flow?
Well, the undergirth of Project Access, if you will, is all about collaboration. What we need is all the affiliated collaborates within the community healthcare system to come together and do what they do best. We need physicians to donate care, and we need the ancillary support of our local hospital and all of our service providers that provide imaging, laboratory work, things like that. Also DME providers. We need them all to come together and donate services, donate time, donate appointment, and we need funding from the community. Those are the things that make it work, and it works by us being able to help our docs out that are volunteering by case managing those visits, making them efficient. Our patients are prepared, and all of these services come together to essentially make that bridge to healthcare specialty come alive.
So as I understand it, Project Access is not a new insurance type of program. What it really does is it creates a format by which to more efficiently maximize the use of charity care in our community. It's tapping into sources and resources that are already being used, but kind of making it work better. Is that correct?
Right. It's basically taking all those resources and organizing them all. So it's the referrals, the patients, the donation of time, appointments, we're all running more efficiently.
So if I were a patient and I needed to have access to Project Access, how would I get connected?
Well, you would first need a primary health care provider. All of our patients must have that PCP intact. And right now we're working with Peninsula Community Health Clinics, and what would happen is a patient would have to be seen there, and a physician would determine the need for the specialty care and make the referral to us. And when we get the referral, we administratively go over it. We make sure that the patients are eligible. They have to be financially eligible, and that means that our patients are at or below 200% of the federal poverty level. Once they're determined to be eligible, we clinically process that referral, and we make sure that the referral is appropriate. We get all of the things in place that when they do go to their specialty appointment, they're very prepared.
Okay. So, as I've heard, that's one of the big selling points for a lot of physicians that participate, is it makes certain that that time with the patient is very well used because they have done all that homework, or actually I should say you've helped to do that homework, making sure all the tests have been collected and that type of thing. So moving on to, well, we have now, what, 5 months or so experience in Kitsap County at the time that we're taping this program, but Kitsap Project Access has had experience elsewhere, as you mentioned, in King and Snohomish as well. So what's been that experience? What are the outcomes there?
Well, in King County alone, there's many healthcare safety clinics, as we call them. These are basically community clinics. And when we started in King County, or I should say before we started in King County, we saw the frustration of the specialty clinics not having a place to send people. They were very burdened, very overwhelmed with all of these people needing access to care. We also saw a lot of overuse of the local emergency rooms and urgent care clinics, walk-in clinics, things of that sort. So once we got started in case managing those patients, getting them access and helping them to get connected to those specialists, we saw the ER use being in a decline. That was reported to us. We also got reports from all of our safety net clinics that they are really having a lot of that burden and overwhelming stress, taken off of them because they have a place to send people. So it's really been financially wonderful for the hospitals and providers in our community because, as you said, the patients are coming well prepared. They're not coming for an initial follow-up appointment and they don't have their stuff, they don't have their laboratory or their diagnostic work done, and they're sent back and then have to come back. This way, with Project Access, we make sure everything is completed. They come prepared. They come with all of those things in place, and the appointment is a successful appointment.
So I'd imagine not only is it successful from the use of limited resources in the healthcare community, but what I'm understanding is that you're probably getting much better health outcomes for those patients, because not only do they have a primary care home, but they're getting connected to the services, and then that continuity flows. So can you talk a little bit about that, or do you have any examples or stories?
Absolutely. As you said, the PCP and the specialty care, we also at Project Access work as a liaison between those two, and we make sure that there's very good communication between the two providers. We make sure that all of their follow-up care is arranged. We make sure that all of the notations for the care that they received goes back to the PCP. It works really well. It works great. In fact, we do have a lot of patient stories, very, very grateful people out there. In fact, I had a patient just last week call me and thank me for an eye appointment that he needed. He needed to have specialty ophthalmology surgery, and he now has his sight restored. This was a man that was unable to work because his work was, he was like a handyman and a landscaper, and he needed to drive and he needed to be able to see what he was doing, and as a result of his illness with his eyes, he was unable to do that, and he was unemployed for quite some time. So he was so extremely grateful to be able to have his sight restored.
So what needs to be in place to make this program a success?
Well, we definitely have to have physicians who are willing to donate care and services. And we find that physicians are more willing to do that when they know that the care that they're going to provide is going to be efficient care and it's going to be well organized and case managed. We also have to have the supportive networks in place by our area hospital, which is Harrison Hospital, who's donated all of their ancillary support, their diagnostics, their operating room use, their physicians, things like that, their inpatient beds. We also need other area diagnostics to come on board with us. We need imaging centers. We need local labs to come into play and say, yes, we want to do this. Because with our doctors' support, we can't do anything unless we have those supporting services in place. We need the funding. We've heard a little bit about the funding that we've gotten, and we're very grateful for that, of course. But we also need patients to be educated about the process that we have with them, as far as them being educated in the fact that, you know, this is a donated appointment. You know, you must show up on time. You must be prepared. If there's a language barrier, we support the interpreters that are needed for the appointment. We need the patients to be grateful for the services that they're getting, and we do really well with that. You know, our no-show rate is 5%, which is very good. Mm-hmm. And we attribute that to really good case management and well preparing our patients. They also sign service agreements with us, so that if they're not adhering to those points that I made, then they have to be dismissed, unfortunately, from our program.
So it's a great indicator that we have a very complex healthcare system, but here's one approach for trying to bridge the gap between those individuals who don't necessarily have the coverage they need to go from primary care to specialty care and back, and hopefully have better health outcomes, and therefore our community is a healthier place. So Ruth Ann, thank you so much for being part of today's program, and for everything that you're doing to help Kitsap stay great and be healthy. So,
thank you.
Thanks. Thank you for tuning in to this episode of Commissioner's Corners. I hope that you learned a lot. We'll have information at the end of the show with websites that you can find out additional information as you need to. But hopefully you were able to take away something and go from there, if not for yourself, for someone that you know or love. So thanks a lot for watching, and tune in next time.